What's fascinating about healthcare is this is a global world, but the rules of engagement are different. And so, for example, we know that the FDA in the US is really kind of having a hard time dealing with some of the new medical device coming out of the market ways, but it's also trying to figure out how to deal with digital health. And so in the US, you see a lot of this kind of slowing down some of these new business models just because there's some uncertainty and some clarification. You start going to other countries like Europe, and you have countries like Denmark and Holland who are way ahead of other people there because the government has had the centralized data for 10 and 15 years, and they're able to be very proactive because there's one decision maker. And they are historically have been always early adopters of new technology. So certain countries, they are very, very proactive. The other thing that's changing, you have countries like in the Middle East and in China, they have an explosion of diabetes. As the income is going up and the middle class is emerging, unfortunately, they're taking some of our worst habit, which is fast food, sodas, and high sugar, carbohydrates diets there, which is creating an explosion of this early diabetes. So they're progressively also being much more forward thinkers in saying we have to do something proactively there because they're on the scales that's even bigger than the US. So we see, I was yesterday at a SOCAP, which is the global meeting in San Francisco on how do we impact health globally. And there were a lot of young entrepreneurs, and their challenges that they have is that they have to come up with solutions that are very low cost. If a baby is born prematurely there and there's no neonatal intensive care units, how can we keep the baby alive with what they got? And so there's some very interesting products that people are coming up, very clever, to be able to sell to remote locations in the middle of the Himalayas, for example. So they have these type of issues there. And so clearly digital health is perceived to be fundamental to get there because ironically, I think 90% now of the population in the world has access to a phone. It may not be a very smartphone, but it's a phone that allows you to do text messaging. Even people may not have access to fresh water and electricity. So this has now become the platform to kind of deliver healthcare in a way that was never done before. So there's massive transformation, very different business and products than in the US.